Hello, my name is Divya Bhargava, and today I'm going to talk about my project, which was No Change, the impact of the FDA warning on the use of opioids and benzodiazepines and their effects in older allogeneic hematopoietic stem cell transplant patients. To get started, I wanted to talk a little bit about the opioid epidemic. Opioids are a type of medication that are used to treat pain by binding to pain and pleasure receptors in the central and peripheral nervous systems. 46 people a day died from prescription opioid overdose in the US in 2016, and as you can see by this orange line here, benzodiazepines contributed to almost a third of these deaths. Benzodiazepines are a type of medication that is commonly used to treat anxiety and nausea. Co-prescription of opioids and benzodiazepines creates a higher chance of respiratory depression and overdose because of the suppressive effects of both medications. Several cautions have been published by regulatory agencies such as the FDA in 2016 and the American Geriatric Society against the co-prescription of opioids and benzodiazepines, and particularly their use in older adults. Allogenic hematopoietic stem cell transplant is a type of cellular immunotherapy, which is depicted by this figure here, in which a person's hematopoietic system, which makes new blood cells, is replaced by donor cells. These type of transplant patients often receive opioids and benzodiazepines to treat pain and nausea. Older hematopoietic stem cell transplant patients face increased risk from opioids and benzodiazepines because of the conditioning program they have to undergo. So that brings me to my research question, which was, what was the impact of the FDA warning on the use of opioids and or benzodiazepines, and how did these medications affect older transplant patients? I hypothesized that the co-prescription of opioids and benzodiazepines would decrease after the FDA warning, and that with the use of either, the number of toxicities would increase and the discharge disposition would worsen. Toxicities were adverse events not related to transplant, and discharge disposition was defined as discharge to a facility other than the home, such as a rehabilitation center. My study sample consisted of a retrospective cohort of all patients aged 40 to 75 at the University of Minnesota who received an allogenic hematopoietic stem cell transplant between April 2011 and December 2018. These patients were divided into two groups, an older and younger group, and the younger group was the controls. The data was de-identified before I received it with a confidential subject number, and consent was obtained before the data was collected by medical professionals. I abstracted demographic information from the University of Minnesota Bone Marrow Transplant Database, and I supported this data with de-identified electronic chart reviews to determine medication, toxicity, and discharge information. My project had two sets of independent and dependent variables. So for the first, the independent variable was the time period, meaning if it was before or after the FDA warning in 2016, and the dependent variable was use of medications, which was defined as more than 10 days of use, because up to 10 days is common for procedures. In the second set, the independent variable was use of medications, and the dependent variables were toxicities and the discharge disposition. For my statistical analysis, I used the general Wilcoxon and chi-square test to compare factors in the young enrolled group, such as demographic factors, and I also used the logistic regression to perform a multivariate analysis to evaluate the impact of age and time period to determine the effect of medication use on toxicities and discharge disposition. I found that the use of opioids, benzodiazepines, and the combination of the two was significantly lower in the older group than the younger group across both time periods, as you can see here. So the older group is in the light blue, and the younger group is in the dark blue. In the younger group, the use of opioids and the combination of opioids and benzodiazepines was significantly lower after the FDA warning, which is the dark blue. But in the older group, None of the use of medications changed significantly after the FDA warning. Female sex was associated with a 2.6 times higher odds of receiving benzodiazepines, as you can see by this yellow marker, and higher comorbidity index scores, which is in green here, was associated with higher odds of receiving both opioids and benzodiazepines, as you can see here. Opioid use was significantly associated with more grade 3 to 4 toxicities, as well as being significantly associated with a 3 times higher odds of discharge to a facility other than home. In the older group, use of these medications did not decline in the later period, which could possibly have occurred because the medication use was already comparatively lower, and prescribers presumed these drugs were necessary, though perhaps inappropriately perceived as safe. Reducing the use of opioids and benzodiazepines in transplant patients even further is necessary because, surprisingly and disappointingly, use of these medications in the older group did not change after the FDA warning in 2016, and also because the proportion of the younger group that received benzodiazepines or both medications was still relatively high in the later time period, as it was 54 and 67% respectively. In conclusion, the opioid epidemic as a whole has had disastrous consequences, and in order to minimize its future effects, identifying and reducing the use of opioids and benzodiazepines in vulnerable subpopulations is needed. Additionally, this study should be taken in the context of its limitations. For example, we only studied the time period where the patients were in the hospital for medication use, so we only looked at 14 days before transplant to 28 days after transplant. A future study could look at a wider time period and find information through follow-ups. Additionally, the subpopulation we looked at was relatively small and specific, so a future study could broaden this range to a wider group of people, such as all cancer patients. Thank you for listening.